Hello, everybody, to all my patients. So I'm going to try to get my YouTube channel started up again. I've tried to start up several times, and I have posted a number of videos that are on the web channel that allow us to review things like important blood tests. And I'm going to start doing more content so that we can communicate with one another. I feel that my best utility to most of my patients is in educating them in health maintenance, maybe disease treatment, but certainly disease prevention, longevity, all the things that most of us are interested in but are not necessarily always focused on in the conventional medical world. So today's video, I'm going to start off with doing one about what we all know is going on, and that is an extremely brutal viral season. It seems like it's been going on forever, but certainly the last 6 to 8 months I've seen a lot of COVID, there's a lot of influenza, a lot of RSV, a lot of adenovirus, there's rotavirus. Even head colds are always viral, typically, even if they're not obviously diagnosed. So because we're all being exposed to them, the key to understand about a virus versus other infections like bacterial infections is your body's immunity, and how the immune system is really the only thing that can battle against a viral infection and rid it of your body. So a viral infection tends to take over. That's why it's more of a systemic illness than a bacterial infection. A bacterial infection may affect your pharynx, like pharyngitis. You may have a lung infection or bronchitis, but typically they're localized and are treated with antibiotics and other antibacterials. Viral infections, however, have to be treated really primarily by your own body's immunity and immune system. So promoting immunity, building up your immune system, keeping your immune system strong, even when you are healthy, is going to be important to not be affected or as symptomatic as many people are getting with these viral infections. Behind me, I've listed a few things that are considered to be the most potent immune boosting supplements. Vitamin D is by far the most important oral immune boosting supplement. Everybody in my office, every one of my patients knows how important vitamin D is for a multitude of conditions and preventing conditions, but immune system is run in general almost like the maestro of the immune system, in addition to glutathione. So vitamin D is important to take on a daily basis. When people are sick or they have an active viral infection, I'll often tell them to double up on their vitamin D, because vitamin D is almost like the gun, the bullets, so to speak, in the immune system gun. And so when you're using them up, they need to be built back up. So having a good level of vitamin D in your system when you get infected will certainly help prevent a worsening infection. Statistics will prove that. Majority of people that die of COVID in the initial COVID disease rates, primarily influenza deaths, a lot of them are associated with deficient vitamin D levels. The other things I mentioned are things that a lot of people have in the house. Certainly have to take all of them, but when you start to feel an active infection, then you may want to jump on some of the ones at the bottom of the list, things like quercetin, echinacea, elderberry, cumin, medicinal mushrooms. Some of these things I take on a either semi-regular basis or sometimes on a regular basis, again, depending on what season, depending on how I'm feeling. But vitamin D, zinc, multivitamin, vitamin C, those should be dailies during this winter time of all these viruses. The glutathione that I mentioned with the stars around it, that's an intravenous supplement. There are some oral glutathione supplements, but they're generally not well absorbed because they don't pass the acid in the stomach well. There are some preparations, sublingual, that really harsh tasting, so people find it hard to stick with that. In the office here, we are doing a lot of IV glutathione with vitamin cocktails for immune boosting, even for treatment of active viral infections. We have a lot of good data looking at how glutathione with vitamin D will keep your immune system very strong. There are a lot of ways to maintain glutathione levels with nutrition, with good sleep habits, with exercise. So there are ways, and these things are easily found. You can look them up. Healthline.com is a great resource to use if you're looking up how supplements can be used for immune boosting and even treatment of viral infections. So I guess my point here is to remind everybody that we are in this season. Most people should have gotten a flu shot. I'm talking to my patients, not to other people. So this is not medical advice if you're not my patient. I'm not really sure how to advise people regarding the new COVID vaccine, the fifth booster shot. There's a lot of data that's really not consistent. There's really not a lot to do for RSV, although there is now a vaccine. It's the first year that it's out. But the one generality of all these viral infections is that a person that has a healthy immune system, a strong immune system, is going to be much less likely to have an active infection or a severe infection. So, obviously, when you're sick, we'll speak by telephone or here in the office. There are other things that we often recommend, depending on the symptoms, things like antihistamines, sometimes cough suppressants, things like that. Certainly with fevers, antipyretics like Tylenol or anti-inflammatory Advil type agents. But generally speaking, let's keep our immune system strong. I see it consistently in my practice. People who are generally living a healthy lifestyle and with strong immunity are not getting severe infections of most of these viral infections that we're seeing. So hopefully that helps to promote wellness, immune boosting. Let's stay well. If you start to see any signs of infection, you'll obviously let me know here in the office. And wishing you a happy new year. Hope everybody's having a good holiday season. And look forward to posting more videos and populating this YouTube channel, again, specifically geared towards my patients and my ability to help educate them. And if you look through the prior videos, you'll see it has a lot to do with things we talk about here in the office, the importance of some blood tests, the importance of supplements, and the importance of trying to use the statistics and data for prevention of disease and to stay well. Have a good day.